Good morning. My name is Adriana Garcia Perez. The human mind is capable of extraordinary things. Understanding the human brain is something that scientific professionals devote their entire lives to. In order to understand human actions and perception, one of the things that scientists do is they conduct scientific studies and trials. One of the concepts that very often goes along with these trials is the idea of a placebo and the placebo effect. Before going into understanding the impact of placebos, it's important to know what a placebo really is. The Oxford Living Dictionaries define a placebo as a medicine or procedure prescribed for the psychological benefits of the patient rather than for a physiological effect. When following this definition, the sentence on this box makes total sense. This box of a placebo with maximum strength says that placebos are as effective as the leading homeopathic treatment. This is true. Placebos on their own don't really have an impact. However, when putting placebos, posing them as an actual drug, the placebos are as effective or even more effective as the drug that they are trying to trick the subjects that they are taking in. There are two types of placebos, pure and impure. A pure placebo is what we usually think of when we think of a placebo. In other words, a sugar pill. A pure placebo, as you can see here, is, as said previously, something that has no physiological effect and is taken in posing to be something that it's not. An impure placebo is what was used in placebo trials before the development of pure placebos. An impure placebo is something that does have an effect to remedy something, but the remedy that it is going for is not what they're treating you for. So an impure placebo, for example, would be using acetaminophen, which is commonly used as a pain reliever or fever reducer, using that to try to treat congestion, for example. When placebos are administered, they target three areas of the brain: the cingulate cortex, the dorsolateral prefrontal cortex, and the basal ganglia. As you can see here, these are the three regions of the brain that placebos target when they are tricking the mind into perceiving that you are healing yourself. Richard Axel's Nobel Prize assertion, Sense and Sensibility, presents this image. This image shows the area of the brain, the antennal lobe, that the sense of smell targets when neurons light up and flare, as you can see in this picture. The connection between this and the idea of placebos is that both of these make a connection with the brain in order to make you perceive something that may not be real. A study conducted by the Recovery Research Institute put forth the drugs of citalopram and a placebo as a control group to rate the depression and anxiety of subjects in both the Hamilton and Beck inventory and rating scales in order to have a more broad understanding of the results. As you can see here, the blue bars representing the placebo are almost as effective or even equally as effective as the drug citalopram, even though the actual drug has no effect. The patients in this study were told that they were taking a drug that would help them, and as you can see here, they were effective in healing the patients. This is another example of how placebos can be almost as effective or even more effective than an actual drug. Irritable bowel syndrome causes many things along with constipation. In this study, elocitron, the black circles, and placebos, the white circles, are put to the test to see which of the two would be more effective in helping treat patients with irritable bowel syndrome. And as you can see here, over the period of the 16 weeks, the white circles, the placebo in this case, averaged a 2.5 stools per day, while the actual drug, elocitron, averaged a 2 stools per day. This shows how placebos are powerful enough to even be more effective than a drug that does have a physiological effect. With this comes the problem of ethics. In order to conduct research that is viable, many times scientists have to deceive, lie to the subjects, and trick them into believing that they are taking a drug that has a physiological effect. In this concept of deception, placebos face an ethical problem as you are lying to the patients to their face, causing them to heal themselves psychologically. This comes to the connection between placebos and something called sham surgery. Sham surgery is very frequently called placebo surgery. And as you can see here in this comic, the patient says, "It looks like I've had an operation," and the doctor replies, "That's the main thing." In this concept of sham surgery, doctors will operate on you and make it seem like you've had an operation while not actually healing anything internally to make your brain think that you are being healed and your mind heals your body. As controversial as these ethic problems are, placebo treatment is still considered an option. Nearly 60% of all American doctors think that prescribing placebos is still an option. As you can see here, 59% of doctors think that placebos are permissible in all circumstances. 31% of them think that it's permissible in rare circumstances, but that they are still permissible. The bare minimum of these think that it's not. As you can see here, goes along with the concept of deception, placebos are 68% of the times described to a patient not as a placebo, but as a medicine that is not typically used to help you, but that can help you. This goes along with the idea of deception, as they are lying to the patients, not telling them that it's a placebo. But the big idea with this is that even though you are deceiving the patient, even though there are ethic problems behind this, the placebo is indeed effective, although equally effective or even more effective than an actual drug in healing the patient, and that's what really matters. Thank you. What questions do you have?
All right, 2 questions for you. Thank you, by the way. 2 questions that I have for you. Tell me how your research question evolved as you went through the process.
Well, when I started doing research, my research question was going to involve more of how placebos work and not comparing them to an actual drug. As you can see here in my presentation, I started talking not just about how placebos work, but also how they are even more effective than drugs that do have physiological effects. So my research involved in the way in putting placebos as an independent idea and comparing them to something so that they would have a comparison to see how effective it actually is.
One more question. What might the real-world implications or consequences of this finding be? And then particularly, how do they affect you?
Well, the implications of this in real life is to show people how easily your brain can be tricked. As powerful as it is, it only takes a certain stimulus, a certain situation for you to believe something. So this idea of placebos, this idea of sham surgery, you don't have to take a sugar pill to get better. As long as you believe that something will happen, it probably will. So the real implications of this are just to understand that life is not really all what it seems and that you can make anything of it.
Okay, thank you.